Hello everyone, this is Dr Ramya Shankar, obstetrician and gynecologist, Ovum Hospital, Bengaluru. Today the topic is bleeding during pregnancy. There are various causes for bleeding during pregnancy and the causes varies depending upon the gestational age, that is the duration of pregnancy. Today let us know more about causes of bleeding during the first trimester of pregnancy, that is the first 3 months of pregnancy. Any woman who experiences bleeding during pregnancy would naturally panic and is very much worried about the consequence, that is whether will she be able to continue the pregnancy, will she have a baby or not. Several questions raises in her mind. Is bleeding common in pregnancy? Am I going to lose the pregnancy? And then what are the causes and what do I do now? Let us answer these questions one by one. Yes, bleeding during early trimester is quite common, and it is said that 1 in 5 women tend to have some sort of bleeding during early pregnancy, and all of them do not land up in pregnancy loss. Having said that, you should know that it is not normal to have bleeding during pregnancy, and hence it is very important that you meet your gynecologist as soon as possible and reach out to the hospital as soon as possible. Wherein the examination will be done in the hospital, where the vitals will be checked. An internal examination would be done as to whether the cervix, which is the mouth of the uterus, is open or not, and that ultrasound examination would be advised by you. Depending on the ultrasound finding, we will be able to make out whether the pregnancy is going on smoothly, or that any internal hemorrhage happening, or has the pregnancy completely passed on through the uterus, which is a complete abortion, or has the part of the products of conception still inside the uterus, which is called as incomplete miscarriage, or sometimes even though the pregnancy looks okay, the os is wide open and patient is bleeding, it becomes an inevitable abortion and eventually she would lose the pregnancy. Sometimes we can also note in the scan that there is some internal bleeding, that is, the bleeding is between the outer layer of the gestational sac and the inner layer of the uterus, and this is called as subchorionic hemorrhage. This is because of the separation of the sac from the uterine bed. If this bleeding is very small, eventually when we were to treat them with progesterone tablets and rest, they tend to continue their pregnancy. In certain cases where the bleeding is more and the separation is more than 50%, then this would eventually lead to pregnancy loss. So these are the findings which we expect during the examination. Coming to the causes, there are various number of causes which ranges from non-severe causes where this does not have any impact on pregnancy. For example, implantation bleeding, where after the fertilization the egg passes through the fallopian tube and gets attached to the uterus called as implantation, and during this time there will be some bleeding associated with pain, which does not have any negative impact on the progression of the pregnancy. Also, other condition called as cervicitis or cervical erosion, where the bleeding is now in the outer surface of the cervix and not through the cervix, and this will eventually stop and subside and doesn't have a negative impact on the pregnancy. Coming to the causes which would lead to pregnancy loss, the most common one is an embryonic pregnancy. An embryonic pregnancy is the embryo fails to grow due to certain chromosomal defects. Certain times there is one extra chromosome or one less chromosome called as aneuploidy, which would also lead to pregnancy loss most of the time, and this becomes unnecessary where pregnancy cannot grow because it is an unhealthy pregnancy. Other causes be endocrine causes, that increased thyroxine hormone or decreased thyroxine hormone. Uncontrolled diabetes also can cause miscarriage. Certain viral infections with high fever can have a negative impact and cause miscarriages. Also, your habit matters. Intake of alcohol, any amount of smoking, and also excessive coffee intake or caffeine intake may impact the pregnancy and may lead to pregnancy loss. Coming to more severe forms, where it would not only lead to pregnancy loss but also would have a negative impact on the mother's health, even costing her life sometimes. One such example is an ectopic pregnancy. Ectopic pregnancy is where the pregnancy, instead of getting implanted within the uterus, gets implanted outside the uterus, for example in the tube most commonly, and then if it were to be left to grow in that place, it would eventually grow and rupture and cause internal bleeding, causing threat to the mother's life. So now you understand the reason why you should really meet the doctor immediately. That one of the reasons is to rule out ectopic pregnancy. Another cause is a molar pregnancy, which is again due to a chromosomal problem, where instead of the fetus, the braid-like structures grows within the uterus, and along with the bleeding, some braid-like structures are also passed through the vagina. This is a non-viable pregnancy and eventually would need an evacuation to terminate this pregnancy. One important thing about molar pregnancy is these women need follow serially with a blood test called serum beta-HCG, because there is a small risk, 2% risk of developing choriocarcinoma, that is the malignancy of the uterus. So other cause is a septic abortion, where there is a lot of infection in the genital region and also in the blood, which may make things complicated, and the mother would need an NICU care and higher antibiotics. Any form of bleeding during pregnancy may become heavy and may need an emergency treatment in terms of the transfusion and surgical evacuation to help the bleeding stop immediately, so that we can make the mother recover fast and save her from losing lot of blood. So usually the pregnancy loss in the first trimester is one such event, and the next pregnancy is usually held. Very rarely, some women may have recurrent miscarriages, and such women need to be evaluated for a condition called as Aplar syndrome or hereditary thrombophilia, where it can be an autoimmune disease. And then, if you were to have a pregnancy with loss which is recurrent, you need to speak to your doctor in detail about this. So, having said all this, I hope you would have understood by now that it is very, very essential that you meet your doctor immediately when you experience bleeding during pregnancy. If any doubts, you can reach out to me at Ovum Hospitals, Ramya Shankar. So in the coming talks, I will be giving more information regarding bleeding during second trimester of pregnancy. Thank you.